If you were to short Cardiol Therapeutics at $1.90 a share in Canadian dollars as of today, you could expect an 85% return by the end of 2025 or early 2026. Indeed, the price target for the drug company, the preclinical biotech company, is 30 cents a share, again in Canadian dollars. And the reason as to why I have this price target in mind is because this is a direct representation of the net cash per share amount that the company has on hand. Now, before I dive into what is Cardiol Therapeutics from a qualitative perspective and also a scientific perspective, I'll first give you the very quick summary of its financial life, if you will. The company currently has basically never generated any form of revenue, which isn't atypical for a preclinical biotech company. And it's currently burning around $3 million in Canadian per month. Keep in mind, the company has $23 million in net cash. So if you do the quick math, the company has around 8 months left to live. Now, they could stay alive for longer, but they would basically issue more equity and dilute shareholders furthermore, which they've done basically for forever. Since 2020, they've almost tripled the amount of shares, fully diluted shares outstanding. And I believe they'll either do this to continue their operations or the company will effectively go bankrupt or will continue to dilute investors, as I just said, into attrition, basically. Now, the more qualitative aspects of the company can be also found in my analysis, which is linked below. But please keep in mind that this analysis, which I've redacted in December 2024, comprises financial data, which at the time was the most recent data. But since then, the company has reported Q1 earnings. So please keep in mind that some of these figures aren't necessarily up to date, such as the price target and the net cash amount of the company. Now, Cardiol Therapeutics is a preclinical biotech company, which has one main drug candidate, effectively, which is Cardiol RX, or stable oral cannabidiol, or CBD for short. The two main indications for this drug are recurrent pericarditis, which is the inflammation of the sac that surrounds the heart, and acute myocarditis, which is the inflammation of the heart as a muscle, of the entire heart itself. Please keep in mind that the only standard of care, not the standard of care, but the only drug approved for recurrent pericarditis is a drug called rilonacept, which currently costs upwards of $250,000 USD per year. And there are no drugs approved for acute myocarditis. Since there is an approved drug for recurrent pericarditis, I will closely compare both the trial designs and outcomes of Cardiol RX and the company that manufactures rilonacept, which is a company called Kiniksa, ticker symbol KNSA. Now, the qualitative aspects of the company are perhaps one of the more pertinent parts of this analysis because the company was incorporated in 2017, yet it swiftly IPO'd in 2018. If you were to travel back in time in Canada in 2018, you would be astonished by the craze around weed stocks in the country right after Bill C-45 was signed into law. This bill legalized weed in the country, which then sparked a huge craze around weed stocks in the country and basically inflated a gargantuan bubble around weed stocks in the country. I think the company timed its IPO very well to profit off of this craze and euphoria around weed stocks. And credit where it's due, they timed their IPO very, very well. The other very interesting bit is that the CEO of the company, David Elsley, has had mishaps with the same indications in biotech with the current CFO of the company as well. So the two gentlemen, which are at the forefront of Cardiol Therapeutics, David Elsley, the CEO of Cardiol Therapeutics, and Chris Waddick, the CFO of the company, have had mishaps in biotech before with the same indications. And that's needless to say, biotech is a very hard industry and I commend them for trying their very best to tackle these indications. However, it's only something to keep in mind for the remainder of this analysis. salute to these gentlemen for trying to tackle a very harsh disease and for at least trying to do something instead of just rambling about a short position in the company. But what's also very interesting is the insider positions of the management team of Cardiol Therapeutics, and more specifically the CEO of the company, David Elsley. Since the company went public, his initial stake of 3 million shares has now been reduced to around 1.5 million shares in the company. So he more than halved his stake in the company, although he directly ties his confidence in the company to his stake in the enterprise. So that's something you should keep in mind. Now, for the more scientific aspects of this video, the chemical structure, the PK, and the receptors of CBD are something you should study quite profoundly. And they're something I've outlined, I think, quite pertinently and concisely in my analysis. But if I were to very much summarize these aspects of CBD, keep in mind that CBD has influence on pain reception and also stress and anxiety, as it influences the 5-HT1A serotonin receptors and also influences pain when activating TRPV1 receptors. I know perhaps this sounds completely foreign, but what this means in general is that some people believe that CBD does influence inflammation, but it certainly influences pain reception, which is a key thesis of the play. Now, what you need to keep in mind towards and in terms of the mechanism of action of CBD is the fact that it influences the NLRP3 inflammasome complex, which, credit where it's due again, I think is the right mechanism of action and is the right target, as rilonacept, the approved drug against recurrent pericarditis, has the same mechanism of action. So in sum, basically what CBD does is that it it completely switches off the NFK beta and prevents the release of cytokines or inflammasomes towards the heart, basically. So it prevents inflammation, in short. And so what you need to keep in mind also is the trial design of the past phase 2 of Cardiol RX. And it was an open label, patient reported pain scale. So in short, what this means is that both the doctors administering the drugs and the patients themselves knew whether or not they were getting placebo or they were getting Cardiol RX. What's more, the patients themselves knew, of course, the medication they were on, but they were to report from a scale of 0 to 10 the pain they felt. In clinical trial designs, there's something called placebo effect and open label biases, which suggest that patients want to feel better. If you succumb to daily pain from the inflammation of your heart, you literally feel like you're dying and having a cardiac arrest on a daily basis, you want a miracle drug to make you feel better. So of course, this opens the door wide open for open label biases. This is a huge problem, and what we should more so measure in terms of inflammation of the heart are C-reactive proteins, or CRP for short, which without any form of bias measure the amount of inflammation, if you will, in the blood of the patients. Now, if we compare the phase 2 for rilonacept to Cardiol RX's phase 2, we would be able to measure that initially, or the baseline for rilonacept in terms of C-reactive proteins was 4.62 milligrams per deciliters. And at the end of the first 8 weeks of the trial, after being on the drug, there was a reduction of 92%, meaning that at the end of the 8-week trial period, the C-reactive protein concentration was around 40 milligram per deciliters. Again, that's a 92% reduction. If you compare Cardiol RX's reduction, we're sitting at around 62.5%, or the baseline of 2 milligrams per deciliters at the beginning, baseline. And at the end of the 8-week trial, we're looking at 0.75. Compare it to rilonacept's 0.38. Again, the lower the better. You want as few inflammasomes or C-reactive proteins as possible. And at the end of the extension period, which is week 24, the reduction for rilonacept was 95% and Cardiol RX's was 72.5%. So credit where it's due again. At the end of the extension period, Cardiol RX had a more significant reduction, but it doesn't compare anywhere close to rilonacept's 95% reduction. Even if we were to put emphasis on the numerical rating score or the patient-reported pain scores from 0 to 10, rilonacept outperformed Cardiol RX under this premise, meaning that the initial pain that patients reported for the rilonacept phase 2 trial was 4.5. And at the end of the 8 weeks, the patient-reported pain was 0.7. Thus, the underlying reduction was around 84%. Compare it to Cardiol RX's reduction of 63.8%. Now, again, Cardiol RX does show a reduction, but it's nowhere close as the reduction of rilonacept. And keep in mind, guys, the patient-reported and open label biases are very much present in this trial design. And at the end of the 24-week extension period, the reduction for rilonacept was 88.9% and Cardiol RX's was 72.4%. Now, most importantly, and if you were to remember one thing and one thing only from this analysis, is that the time until pericarditis recurrence, which is the main premise of this indication of this illness, was also studied in both studies. And so in the phase 2 for rilonacept, no patients reported a recurrence in the disease. So patients were effectively cured. They didn't have recurrent pericarditis. They didn't have a recurrent episode of pericarditis or inflammation of the sac that surrounds the heart. And in terms of Cardiol RX, around 30% of patients suffered from, I wouldn't say a relapse, but a recurrence in pericarditis. That's 7 patients out of 24. So around a third almost of patients suffered from recurrence in pericarditis. So the drug doesn't necessarily work in terms of curing the recurrence of the disease. And if, again, we go back to the chemical structure, the receptors, and the PK of CBD, we know that CBD influences pain reception, stress, and anxiety. So if you open the door again to open label biases, it would not be too much far-fetched to assume that patients simply didn't feel the pain instead of the inflammation actually being gone. So patients were simply not feeling the pain whatsoever, but it doesn't necessarily mean that the C-reactive proteins were halted whatsoever. Now, in summary, the main essence of this analysis will be dissected and divided into the pros and the cons of my analysis. So in terms of the target the company has and the safety profile and the preclinical science that CBD represents in correlation with inflammation, I think they have the right target and the safety profile is quite strong. The main indication to really follow is recurrent pericarditis, as we have something tangible to compare with, meaning that Cardiol RX can directly be compared to rilonacept, but ultimately, if the drug shows extreme performance and a high safety profile, it should get approved. But if it fails to get approved for recurrent pericarditis, forget acute myocarditis. It's a way harder indication with no drugs approved. And heart failure, you can forget that as well. Something else to keep in mind, is the fact that both the CEO and the CFO of Cardiol Therapeutics have had mishaps in biotech before with the same indications. Now, again, this isn't uncommon in biotech, as it is perhaps the hardest industry to outperform in. And especially these indications do prove to be very, very difficult to tackle. So again, I commend these individuals and I wish to be proven wrong in terms of my analysis, but I doubt I will be proven wrong. Since the stock IPO'd, the CEO has been dumping shares. And so even though he ties his confidence in the company towards his stake in the company, he halved his stake in the company from 3 million shares to around 1.5 million. So that's another thing to keep in mind. The company has no partnerships, which isn't uncommon, but generally speaking, when a company has a very good prospect of a drug, there tends to be a lot of appetite towards partnerships or commercialization by other large pharma companies. Again, the underwhelming phase 2 results in CRP and NRS cores versus rilonacept don't suggest that the drug should get approved based on the current approved rilonacept results. And the high number of phase 2 recurrent cases, sitting at around 30% of people on Cardiol RX versus rilonacept 0% recurrent cases, don't suggest that the drug works whatsoever, because almost a third of people that were on the drug had recurrence in pericarditis. Now, inversely, where I might be wrong and where the main risks and caveats of my analysis stand are the latter. The drug isn't completely inefficient in terms of its reduction in cytokines and the concentration in vitro preclinical tests. Now, preclinical trials or preclinical science isn't indicative of anything in regards to phase 3 results and approval, but it's something to keep in mind again. The safety profile of the drug is very high and slightly better than rilonacept. And also, the drug would be priced at around a fifth of what rilonacept is currently priced at, or more or less $250,000 to $300,000 USD a year. And that's something that is quite significant, and the FDA does keep in mind, given that the overall production of the drug would be easier and cheaper, but it's very much not the main premise under which the drug should get approved or not. The performance of the drug with hard facts in its phase 3 is basically the only thing that the FDA will keep in mind to get this drug approved or not. And the better administration of the drug versus rilonacept is another key component of the FDA approval process. So stable oral cannabidiol would be administered online, would be an oil that you would ingest, versus rilonacept, which is subcutaneous. So it's administered on your skin, basically with pads or by injection, versus CBD, which is ingested normally, orally. So again, the price target I have for CBD is around 30 cents a share Canadian, and the stock currently trades at around $2 roughly a share in Canadian. This directly represents an 85% return by the second half or year end of 2025 or early 2026. Please feel free to dissect my analysis and give me a lot of your rebuttals wherever I can be reached in the comment section, or please reach out to me anywhere else.